listening good today and tomorrow, huh?
Yes,
So you'll
ma'am.
be prepared for Friday?
Yes.
Okay, good. All right, but let me tell y'all something. I need to know, first of all, who in here did not come to our program here in level 2? How many of you? We're not in our program in level 2. Okay, about 4 of you. Okay. All right. The reason that I'm asking that question is because a lot of the content we covered in level 2. So it's just kind of a repetition from level 2. You should have a good background on this, the ones of you who did come here. All right? So it's not going to be a whole lot of new information for some of you. But the ones that did not come to the program, and this may be the first time that you're hearing some of these conditions, you might want to really pay attention, so that you can do well on this test come Friday. All right, y'all know that I like to talk to you a little bit about the objectives right up front, so you'll kind of know what you're up against as far as that's concerned and how we test. Also going to mention the concepts that go along with this content. And if you don't know, you're in alterations in immunity. All right? Just in case. Now, you're going to have 2 contents on this test Friday. That's going to be metabolism, right, and immunity. And both of those are pretty intense. Has a lot of information. But it's information that's realistic that you can learn and will do well on. So, moving right along. On the objectives, as far as, who is that?
The lady from the front desk.
Who? No, she left. All right. Okay, y'all don't see Leslie lines in here, do you?
Nope.
Okay. All right, y'all know about the objectives and how they flow. I'm just going to run through them until we get to the content area, and then I'm going to talk to you more about the content. All right, the first objective has to do with that comprehensive assessment. And y'all see that a lot of times, as I mentioned before, when I was here talking about objectives, that it kind of always starts out with doing a good assessment. And you all know that you're tested a lot on questions that relate to assessment, right? So a lot of these content areas are pretty straightforward that we're going to be doing in immunity. So, for instance, if you are assessing a patient with rheumatoid arthritis, what you going to look for? What might you see? Okay. We're going to go over that as we go through this process. But y'all know this stuff, guys. You know a lot of this. But that's what you'll be tested on, is if you see people with certain things and what does that mean. So you'll have to do a good assessment to know what you're going to do for this person. It talks about doing a good health history, a good physical assessment, vital signs, lab findings, and all that's included in a good assessment. The next objective has to do with just knowing your basic anatomy and physiology. And you have to kind of have that background on these conditions in order to understand them. And so it talks also in here about nutrition and how that relates to these conditions, and how you're going to make a good plan of care for that patient. For instance, if you had a patient that had gout, is there certain nutritional things you need to think about in that area? Mm-hmm. Right, okay. And if you have a person who has HIV/AIDS, is there certain things you need to be conscientious about as far as their nutrition? All these conditions, this is not rocket science, this is just stuff, okay, that we do. And you all understand this. This is pretty simplistic in understanding how the diet and nutrition plays a part in this. All right, the next one has to do with setting priorities. Y'all have set priorities for a couple of semesters now. You know how to do that. All right? All right, let me ask you this question. What comes first as a priority?
A.
and as a concept?
Assess.
Huh? Safety? Safety. Chances are, if you go, I was in simulation yesterday, and this is why this comes to my mind, is, I was in level 1 simulation. Level 1, okay? And whenever the simulation was, a lady that had a bilateral knee surgery, knee replacement, okay, I guess. But anyway, she had 2 incisions on her knee. And in the room, there was water spilt on the floor. There was a dirty bandage on the floor. The catheter bag was laying up in the bed, and different stuff like that, okay? And when you go in, even though you're assessing, you're looking, right, at stuff, you're capturing all that. But the number one thing is safety, right? So cleaning up that water, getting that catheter bag down where it needs to be, all those kinds of things is the priority, right? Okay. And of course you are assessing, but then you get to the actual physical assessment. So those safety issues were priority over that actual physical assessment, right? At that moment, looking at the patient, that's what I mean. If the patient's in the floor, that'd be the priority, right? But, are y'all following what I'm saying? So y'all are getting better at setting your priorities and looking at what needs to come first and what you do first. The next one has to do with medications. And y'all are always going to have test questions, on medications. There's going to be some that you just have to know about. And my recommendation is that you learn about the classifications of the drug. If you know that, then you kind of know what side effects and things that go along with those classifications. Just like with our heart drugs or the HIV drugs, okay? I don't even know how to pronounce most of them, okay? But I know what they do. I know, about how they help to decrease that viral load and stop that replication of that virus. I know that's the purpose of them. And if you think conceptually, and that's what we talk about with concepts, is you think about what applies to a lot of things and the big picture. And, not isolate it down into knowing this one's got side effects of nausea and vomiting and diarrhea and so forth and so on, right? Because most of them have that, right? Okay. But you know your classification and what the purpose of it is. All right. The next one has to do with labs and diagnostic tests. So as we talk about a lot of these conditions here, we're going to talk about what role does the CBC with the differential have in some of these conditions. We're going to talk about what is the ANA, the ESR, the CD4, the EIA, the Western blot. And the RH factor here, to me, is the rheumatoid factor, not the RH negative blood. Okay, we're talking RH factor being rheumatoid. Immunoglobulins, viral load, creatinine, and they've got chain reactions. It's listed here, the different types of labs that you need to be aware of and know kind of which one of these conditions it goes along with. Why is it important for you to know about, with rheumatoid arthritis, some of these labs? Okay? What do they indicate? The sixth one has to do with looking at demonstrating the use of proper therapeutic devices and how they're going to support a person who has an alteration in immunity. And as we go through, rheumatoid arthritis, that's another one that we can use, as far as therapeutic devices. So we'll talk about that as we move forward. And then the next one has to do with just what is your role as a nurse in taking care of these people? What do you do? What's going to help these people have their positive outcome? The next one has to do with providing that education to your patients. And y'all know, you always gotta educate your patients, but you gotta educate yourself first. Because if you don't know it, you can't teach it to somebody else, right? Okay. The next one has to do with legal, ethical things. Which one of our conditions do you think we might touch on some of that? HIV/AIDS. That's right. That's one of the big ones that we have to think about, legal and ethical issues. All right, so that's basically your overall objectives. Do y'all see how that pattern has worked pretty much for most of your objectives? It's kind of a pattern that runs through. Okay, the content topics that we're going to talk about. There's some that's not on here, and I'm going to, let me get myself over here so I don't forget any of them. First one has to do with immunosuppressive disorders, HIV/AIDS. That's the one we're going to cover. All right, so you need to know about HIV/AIDS. You all have had, like I say, prior to now, you've had some lecture and information on HIV and AIDS. More so probably HIV, but the ones that you who have not, just make sure that you review that. On the second part, it talks to us about autoimmune type disorders. Now, we're going to talk a little bit about how that works, but the ones that you're going to need to be responsible for here, and I'm going to list them out for you, okay? Guillain-Barré, myasthenia gravis, systemic lupus erythematosus, rheumatoid arthritis, gout, ankylosing spondylitis, fibromyalgia, Reiter syndrome, Sjogren's syndrome, and scleroderma. So there's quite a few, okay, that you're going to be responsible for knowing. Hopefully at the end of tomorrow you'll know them all, okay? At least what you need to know about them, okay? All right. That's pretty much our contents as far as the topics. And there's 11 of them. The next objective has to do with pharmacology, which is corticosteroids. Now, tell me. Let's talk about that for just a minute. What is a corticosteroid? Who knows? Does anybody know what one is?
It's used in anti-inflammatory response.
Do what now?
It's used for an anti-inflammatory response.
For an anti-inflammatory response. Okay. What kind of condition would it be given for if it's used for that?
Rheumatoid arthritis.
Rheumatoid.
Okay, like arthritis, right? Rheumatoid arthritis would be one. Okay. There are things that go along with giving these steroids, though, right?
Yes, ma'am.
And what kind of things are you going to watch for if a person takes corticosteroids?
Sugar levels,
Sugar levels, what?
immunosuppression.
Immunosuppressant? Okay, what does that mean?
Their immune system is decreased.
Does that make them more susceptible to an infection?
Yes.
Okay. So when you start thinking about immunosuppressants, regardless of what they are, and you've got another objective that talks about calcineurin inhibitors, cytotoxic, monoclonal antibodies, those kinds of things, okay? When we're talking about something that's going to depress the immune system, then that is going to open a door for other things to happen to this individual, right? Okay. So we have to be understanding it doesn't make any difference what causes a person's immune system to to be down, whether it's a medicine or a condition. What about HIV?
It decreases their immune system anyways,
That's right.
just by itself.
Just by itself. Okay, so this is concepts, y'all. This is what we talk about thinking conceptually, is that when we're talking about classifications of drugs, okay, if they suppress the immune system, they suppress the immune system. If you've got a condition like HIV that will suppress the immune system, it still suppresses the immune system. It doesn't matter, a person who gets chemotherapy, right, for cancer,
Right.
okay? And then we may even give methotrexate here for a condition, right? And if we give that, is that a form of chemo? Yes, it is. And that's gonna suppress the immune system. So I just want you to kind of think the big picture there when you're thinking of these drugs that are immunosuppressants. Are you thinking conditions that decrease the immune system? Whatever the case may be, it's all the same. It still decreases that immune system and opens these people up for complications like infection. Okay? Because you take that step further, what's happening to this person if they have, say, HIV? What's causing them to be more susceptible to an infection? How are we monitoring that? How do we know?
Oh, monitoring their white blood cells?
Okay, what kind of cells in particular for HIV?
T cells.
The T cells, which are the CD4 T cells. You see what I'm saying? But if you've got a person on the opposite side of that, I'm just trying to explain these meds a little bit right up front, because sometimes we run out of time on meds, and I just want y'all to understand that. If I can hit that airway open. If you've got a person who's taking chemotherapy though, or even methotrexate or whatever, if they're taking a chemo drug, what is that? What lab we gonna look at for that one to indicate that they might be a little immunocompromised?
WBC.
That's right, the white blood cells, right? Because as you know, with the chemotherapy, we talked about that, the time period where a person's white count gets really low, nadir, you know, where it's really low after they get that chemotherapy. And my son, for instance, he had chemo, he had a bug bite, put him in the hospital. Just a mosquito bit him or something, because his white count was so low at that time. I say all of that just to explain to you that when you look at immunosuppressants, just know that they all kind of do what they're designed to do. Okay? They're gonna help one thing, but they may cause another issue. Okay? Everybody with me? Mm-hmm. All right. And you've got, one of your objectives on your content on the drugs has to do with your heart drugs or your antiretroviral drugs. And basically these are your HIV drugs. And when we talk about HIV drugs, all right, in HIV, and I'm gonna kill somebody's thunder here because y'all gonna have to talk about that somebody in a little bit. But when you have a person who has HIV, then there's two goals that we want for that person with HIV. One is that we increase the CD4 count, because that's the cell, those CD4 cells are the ones that the HIV virus is taking over and making into an HIV cell. Okay? So if they're taking over the CD4 cells, then we're gonna have less of them, right? Okay. And then what's gonna happen in the blood is the more of those cells that are taken over, that means that there's more of the virus in the blood. Y'all with me? So two things. Our goals for people who have HIV with this heart therapy or antiretroviral therapy drugs is to, one, increase the CD4 count, which these drugs keep that virus from taking over those CD4 cells. So we have more of them, so we have an increase in CD4 cells. And the other goal is to decrease that viral load, which means that there's less of the virus detected in the blood. Make sense? That makes sense, okay? So when we're talking about these heart drugs, what we want them to do for us, I don't care if it's the NRTs or the NNRTIs, you know, the protease inhibitors, I don't, you know what I'm saying? It doesn't matter which classification of drug it is, they're all trying to serve one purpose, and that is to increase that CD4 count, decrease that viral load. Okay? And so they do it in little different ways. Each one of them has their mechanism of helping to accomplish that goal or those goals. But I just want you to understand, you know, the big picture. So, if I had to say it in one sentence here, is these drugs will stop the replication of the virus. Okay? You can't stop the transmission of a virus, right? Can't make people stop transmitting it, all right? Can't do that, all right? You can't kill it, or they'd have done it, right? But hopefully these drugs can stop it from taking over those cells and replicating. Okay? All right. Okay. And then we talked the immunosuppressants, the calcineurin inhibitors, cytotoxic antibodies. We'll be talking about more of that with the arthritis and such, okay? And then we have the nutrition, which we mentioned the gout's got special issues there that we need to consider. And then you've got the high calorie, high protein diet. Where y'all think that might come in?
AIDS.
That's right, the HIV/AIDS patient, okay? Because they have lots of issues with not eating well, losing weight, okay? And then they may have some issues with healing, you know? So that high protein, high calorie diet, y'all heard that before, right? And healing and such. Okay. All right, that's just kind of an overview of the objectives. I know I went off on those drugs a little bit, but I tend to run out of time sometimes with those drugs, so I just kind of wanted to throw a little bit in there up front. So the next thing I want to go over with you before we move forward into the content is the priority concepts. Y'all have a PowerPoint that is a voiceover PowerPoint that talks about your concepts. Have y'all seen that on your module? Okay. I don't know if you've listened to it or not, but it might help you, you know, as an overview. Because when you start thinking about these different concepts, and like I was talking to you about the drugs, and I try to help you understand concepts a little bit better as you move forward. Because if you take any of your conditions that you have, and you think about them, and you think about them as a whole, you know, don't just tear them all apart, but just think about in general, like inflammation. A lot of these autoimmune disorders that we're going to talk about involves having inflammation, right? Mm-hmm. And you've got to understand a little, like we talked about with objectives, a little bit of your pathophysiology and how things work in your body. What happens when a person has an autoimmune disorder?
Their body's fighting itself.
That's right. The body is fighting itself. We all have our own individual cells, right? We have our own barcode, if you will, all right? That our body knows it's us, okay? And if something else gets in our body, like an antigen or a bacteria or something gets in our body, then our body knows that's not normal for us, and it builds up antibodies that can fight it off and get rid of it. And then hopefully the next time it happens again, then, we don't be bothered so much with that. And that's the way our body protects us from the outside world. However, sometimes the wires get mixed up or something happens and the body starts fighting its own cells. And as a result of that, it causes damage and problems. And one of the things that happens is that our body starts giving off signals that something's not right. And inflammation is one of them. And that's one of your immunity concepts, is that, we start having this inflammatory process. And there's a lot of these labs that's listed on your syllabus here in your module, objectives, that refers to checking for inflammation in a person. And they know that sometimes these folks have these autoimmune disorders based upon that inflammation. All right, so we've talked about kind of how the pathophysiology works there, and inflammation is one of the priority concepts. Can you have an infection without inflammation?
Yeah.
Yes.
Think about it. You can have inflammation without an
Yeah,
infection,
not the other way around.
but when you have an infection,
You
you
got
have
inflammation
It's
somewhere.
an inflammatory response.
Yes, an inflammatory response. Huh? Does that make sense? Sort of? Okay. All right. And y'all know that we can have local inflammation, or you can have systemic, All right. People can have sepsis, in other words, okay? They can get septic as it relates to an infection, because what's going to happen sometimes is people will get an infection. So that's going to be one of your other concepts. You'll have inflammation, and then you're going to have some, sometimes you'll get infection. Sometimes, like with, let's think about rheumatoid arthritis as it relates to this. What do you think? If a person has rheumatoid arthritis, do they have chronic or acute type inflammation?
Chronic.
Okay. When would they have an acute?
At the beginning stages.
If they have an exacerbation.
Okay. That's right, because you know what? Sometimes people with some of these autoimmune disorders, they have what we call exacerbations or flare-ups. Okay? So what happens in these situations is, it exacerbates at that time, but then it can get better, right? All right. If a person had a really, like in rheumatoid arthritis, if they got a really hot joint, real inflamed joint, okay, that's more of an acute situation or an exacerbation, right? Okay. The next one on the list was tissue integrity. People who have alterations in their immune system, if you've got a hot swollen joint, that might be something dealing with tissue integrity too, right? Okay. Anything, what can y'all think of, something else that might relate?
Diabetics.
Okay, people who have diabetes. Okay, all right. Let's think about autoimmune disorders. Some of these disorders I just mentioned a while ago, can you think of one that might indicate that they'd have something wrong with the tissue there, other than rheumatoid, which we just talked about? I'm thinking of one right now. And as we go forward, this is why I'm saying this to y'all. Y'all think of these kinds of things so that you can relate some of these concepts to everything, not just one thing. what was, y'all remember one of those things? What, let me just say this, the big toe.
Gout.
Okay. Can you see where that might be an issue? As far as tissue integrity? Huh?
Mm-hmm.
It would be a big red inflamed toe. Okay, scleroderma. Okay, scleroderma with the skin. Y'all see this as we move forward. That's why I'm telling y'all to think like this a little bit. It might help you to remember things. Y'all, I tell you, what I used to do, and we don't have time, I don't think, to do this, but I used to, I would have these topics, I'd have groups would get together and they'd come up with a YouTube that related so we can see what these conditions look like. And the one on gout made the most, well, one of the most impressive I've seen. There was a person, they showed the video where a person had gout, not in the toe, but in the heel. And it just showed all kinds of pus and stuff coming out of that heel as a result of having a severe attack of gout. That's tissue integrity, right? Okay? And you also think about, if you think of HIV even, you know about tissue integrity there. You know, they have issues with a lot of diarrhea a lot of times. So, y'all follow me, right?
Mhm.
Y'all understand what I'm saying. But I just want y'all to see how these concepts relate to the immunity. And then stress. All right, what does stress do to the body in general?
Makes it crazy.
All right? Do y'all think that stress can cause problems in the body?
Mm-hmm.
Okay. All right. Some people don't think it does. Well,
I was thinking the same.
okay. All right. Physiologically, though, let's think of something. If a person has a lot of stress in their body, what's going to go up? All right, y'all want that metabolism, huh? What does that do to blood sugar?
Makes it go up.
Okay, makes it go up, right? The liver dumps out a whole lot of extra sugar in response to that stress. Okay, and if you've got a person in a trauma situation, y'all, I've taught diabetes for years, and I know teaching patients and them coming into the hospital setting, a lot of times they would come in from a trauma, okay? And that trauma in itself, that blood sugar was higher as a result of that. They would come in with a bad infection. That blood sugar was up as a response to that. Most often when those children came in newly diagnosed with type 1 diabetes, they had had the flu a few weeks before. Type 1 diabetes is an autoimmune type disorder. Don't know why it happens, but it does. The beta cells are destroyed by itself. So the beta cells in the pancreas don't produce the insulin anymore, so therefore they have to take it from the outside. Okay? But back to the blood sugar. In the ICUs, in the hospital, a lot of times people who don't even have diabetes diagnosis, they will be checking blood sugars because that stress to the body causes that rise in the blood sugar. Okay? So, a lot of times they end up on insulin when they had a pill when they came in, right? While they're in the hospital. But then they go back home after the stressors are out and they're able to go back on their oral meds. But the point of that is that in any type situation, stress, okay, can cause problems. All right, the other one here has to do with nutrition, which we've talked about the importance of, healing and all with nutrition. Different ones have to have their nutritional requirements to be able to get better. All right, so safety is a big concept as it relates to any of our conditions. Stress, nutrition, inflammation, infection, and tissue integrity are the ones that we have listed here, okay? I just wanted to make sure I went over that because I think y'all need to start thinking a little bit like that about how the concepts work and how you can think on the big picture rather than just thinking individual stuff. Okay, it may help you think about how it works with a lot of stuff. Okay? All right. I don't have a list of your, who all's in here. I don't know how many people are in here. But I have a poster board here, and this is what we're charged with, okay? And I've done this for several semesters, and the students have done well on the exam as a result of it. It's not because I want to keep you busy, but it's because I want to help you pass this test come Friday.
Yep, thank you.
And so in order for you to be able to do that, you're going to have to participate in this in order to do it. I can stand up here and just talk to you all day long, but, you know, I see half of you won't go to sleep now. So it is kind of like, I don't want to put you to sleep too soon, all right? But you got to pay attention, guys, because you got to learn this stuff to be able to do well on the test. So who, let's see, how many people we got? Around 40? Does that sound right?
It was 48
Okay.
to begin with, so I don't know.
I need 4 of you to get together. And I'm gonna give y'all a topic,
Okay.
all right? And once you have done your, topic, then we're gonna start going over them, 11 of them, okay? And then tomorrow, after we get them, after we all go through them, then tomorrow, at the end of the day, hopefully we can go around and make sure everybody is good with them and we don't have any questions about the content. All right?
Okay.
So who wants? Let me just make sure. Do I have enough? Has everybody kind of got 4 people in your mind who you're gonna be with?
Yeah, pretty much where we all sit. Pretty much where it works.
Y'all 4? Okay, let's just go for it. All right. All right. Y'all gonna talk about HIV/AIDS.
Okay.
Okay?
I need to go pee.